Hi, and welcome again to Nurses Talk. My name is Lisa Tomka. With me, as always, is Carrie, Nurse Kevin. Welcome back.
Good morning.
We have a lot of different backgrounds in nursing. For example, Carrie, what's yours?
Oncology or cancer care.
Cancer care. Kevin?
I started in the ICU, and then I became an adult and geriatric nurse practitioner.
Nurses don't just work in the hospitals, they don't just work in clinics, sometimes they fly in the sky. So let's invite Chief Flight Nurse Kyle Madigan from the Dartmouth-Hitchcock Advanced Response Team. Kyle, welcome to Nurses Talk.
Thank you very much.
Oh, man. Carrie, keep your hands off.
So tell us, what does it mean to be a flight nurse?
To be a flight nurse is a subspecialty of nursing, obviously, and there's two different ways one could be a flight nurse, either in a fixed wing or an airplane type environment where you're generally taking patients from one facility to another facility, or you could be a rotor wing nurse or a helicopter flight nurse, which is what I do predominantly. And so as a helicopter flight nurse, we respond to both accidents on the side of the road, out in the country, wherever that injury or traumatic event might have occurred, and transport them directly to a higher level of care, a trauma center, we would say. We also do some inter-facility transfer where we'll go out to local hospitals, rural or regional hospitals, and pick up injured or ill patients and again bring them to the tertiary care or higher level of care that, say, a teaching hospital or an academic medical center might offer.
So if somebody were considering nursing and then considering flight nursing, what would be the logical
Yeah, how do you get
path
there? How do you get there? Because I
there?
bet it's just not, you don't just graduate from nursing school and you're a flight nurse.
No, it's not a place that we entertain new graduate nurses. We look for the person to have at least 3 to 5 years of critical care experience. Preferably that would be in a larger institution that sees a higher acuity, perhaps a higher volume of patients. We would also like a person that has a combination of ICU, like Kevin has, as well as some ED experience. And that ICU experience could be specialized as, say, a cardiac or a medical intensive care unit, or even a combination. We see a lot of patients through a broad age range. And so if you have pediatric experience, if you have adult experience, it certainly helps. Once you have those core experiences and certifications, that's the time when people can generally start to apply for a job. It also would help if they have some sort of pre-hospital experience. A lot of people that go into this as a nurse were either an EMT or a paramedic before they were a nurse or while they've been a nurse because of that pre-hospital component to the job where we do go to the scene of an accident.
So is it a bachelor's prepared nurse or is it an advanced practice nurse that's in the role?
Traditionally, it is an ADN or a BSN, Bachelor's Prepared Nurse. We are now seeing with the explosion of nurse practitioner programs, and especially the acute care nurse practitioner, we're starting to see some of those nurses beginning to come into the role of flight nurse. It still is not the predominance, but we're seeing a transition in the industry over the past 5 or so years, so it'll be interesting to see in the future where it really goes. But right now it's a registered nurse and an EMT paramedic.
So is there a personality that's drawn to
Oh,
this
that's a
kind
really
of
good
nursing?
question. Who are you, Kyle?
What's interesting about it is we tend to have a lot of people drawn to this that are the go-getters, the overachievers of their department, of their program. The other piece of it is that they're rather type A personalities. We work in a very uncontrolled environment, and so we try to control whatever it is that we can possibly control. And so that's just our nature. We want to get everything tidy and neat in the way we want it, the way we like to care for patients. And in such an austere environment, that's not always possible.
So you're kind of like adrenaline junkies and control freaks all at the same time?
I have one of the best jobs in nursing, flying around in a helicopter, helping out injured or ill patients and getting them back to a tertiary care facility is very, very rewarding and very exciting. But getting home safely at the end of my shift is really my
It's risky,
ultimate
man.
goal.
Yeah.
And so safety has to be the paramount foundation that you operate on each and every call. There's really no layer or level of complacency that you can tolerate in this line of work because it's so different than other types of nursing.
Yeah.
It sure is.
Absolutely.
Kyle, our audience, like, I want to be a flight nurse. Is there some place they can go? You have a national association, correct? You were the president of the National Association. What was that?
Yes, I was. The National Association is called the Air and Surface Transport Nurses Association. And so we represent those nurses that either fly in an airplane or a helicopter or do transport by ground ambulance, water ambulance, whatever it might be.
That must be an uptight conference.
Control freaks and adrenaline junkies everywhere. What do you do?
ASTNA.org would be the ASNA website. We're very focused on education. We have a nationally recognized trauma class called the Transport Nurse Advanced Trauma course, which teaches transport nurses how to deal with patients with critical injuries.
And is there a certification?
There is.
There is?
There's actually 2 certifications.
Well, I see the letters after your RN on your badge.
Right, we have the certified flight nurse as well as the certified transport nurse. So CFRN or CTRN. And again, it's to recognize both of those different specialties, whether or not you're doing air medical transport or perhaps you're doing ground critical care transport. So we have 2 different certifications. And some people have both, or you can get one or the other. And you can get more information about that at www.bcen.org.
We could talk about this forever, I think. And the one thing I've learned, I love the look of a nurse in a flight suit. The helmet is the bomb. That is awesome. Kyle Madigan, RN, thank you for joining us on Nurses Talk. This has been awesome.
Thank you very much for having me. This has been great.
Join us next time. We're going to keep on going with important topics. We're going to bring more careers in nursing to the audience so they can understand the diversity that is the profession of nursing. See you next time.